Hello everybody, it's Dr. Steve back with another episode of Core Wellness TV, and today is another 3 pillars, yes, 3 pillars edition. And we're going to be talking about, I'm going to use some of my private client, my patient files from this past week and give you some of my best lessons about mindset, movement, and nutrition. So here we go. Number 1. Actually, a former employee who used to, one of my first former employees like 10 years ago, actually 13, 14 years ago now, anyway, she came in and she had chondromalacia patella. That sounds very scary, doesn't it? Chondromalacia patella. And the doctor who diagnosed this told her she would never do high impact activities again. She's mortified. High impact activities is what gives her joy. So I said, well, let's just take a look. There's no reason to be alarmed. And what we discovered is that, lo and behold, some trigger points in the muscles around her knee were referring pain into her knee, and some muscle imbalances from her hip. You know, she had a hip that wasn't quite doing what it was supposed to do, and the hip and the glute and these kinds of things are the main stabilizers for the knee. So we looked upstream. We didn't look actually at the knee. Of course, I did some orthopedic exam just to make sure there was no, ACL tears or any kind of orthopedic surgical type of things, and there wasn't. This was just a very simple case of muscle imbalances, trigger point tenderness that were causing pain to go into the knee. What did we do? Simple releases, very simple. Anyone who does any kind of active release technique, ART, or soft tissue, people who do soft tissue release techniques, preferably physiotherapists, physical therapists, or chiropractors, or anyone who is certified in these kinds of things and knows how to do these things, released her lateral quads, her middle quads, and her medial quads, released the patellar tendon underneath her kneecap, and had her sit down again. No pain on her squat. Okay, so there's number 1. Let's not get caught up in scary names and prophecies of no hope, right? So anytime you get a message of fear from a diagnosis or a scare, we need to say, stop. This is just the outcome of all of the dysfunction and imbalances that have been building up in my life up to this point. So let's look at what are those dysfunctions and imbalances and processes in our body that are not working correctly, and let's go fix those, and let's see what happens with the quote-unquote condition. Got a text, actually Rebecca, my wife, got a text last night from her and said she bounded up the stairs for the first time in months and did not even think about it. High impact. So, don't get caught up in, that's a mindset piece, don't get caught up in conditions. Always think processes and where's my dysfunctions, where are my imbalances. That's what we teach, that's what we do, that's what the course is all about, that's what the Core Wellness Institute is all about, teaching you how to find and fix these imbalances in your own life so you don't have this stuff. What's the next piece? Miss Katie. 3 months ago, reached behind her seat while she was driving and felt a pop and was basically unable to move her arm. And so she went through the route. And I had not seen her, treated her before. I had seen her, I've been seeing her husband for a long time, and I had not seen her before, but she came in after 3 months post-injury, and she had been to an orthopedist, had an MRI, and all this stuff, had an injection and a steroid pack and all this stuff, and she came in, and what did she look like? She looked like this. You know, very, very limited range of motion, and the reason this is a movement piece is because I want you to understand that any kind of injury or stress or protection thought, any kind of stress in your body, and especially an injury, will cause you to do what? She had an injury to her shoulder. What did she do? She did this. She protected. I'm well aware of this. I've had 2 shoulder surgeries myself, so I'm familiar with the protection posture. Okay? But that's what she was in. She was in protection zone. What did we do for Miss Katie? We took her shoulder, and I took her shoulder, and I just basically allowed it to gently and passively be distracted and pulled away just ever so slightly. You know, we know that there was no tears or anything, so I'm free to mobilize and get her shoulder moving again. Guess what? Just with getting her body and getting her shoulder joint back in a happy place again, because she was here, right? This is not a good place for your shoulder joint to be. Like, here's your socket, here's your ball, and the ball is like way in front of the socket. This is going to cause constant irritation to the glenohumeral joint, your shoulder joint. So we took that joint and we got it back into this place, and you should have heard her. She was like, oh, that feels so good. That feels so good. You know, what's up with that? And I said, well, we're just putting your shoulder back in its happy place again. And just by putting your body back in its natural, organic, centrated position, you automatically get this feeling of, ah. And that's what happens whenever we do it ourselves as well. Whenever we push away from our support points. Remember, organic posture is really nothing more than pushing away from our support points or our imagined support points. If I was to push away from an imagined support point here, what's going to happen to my shoulder? It's going to go down and back. That's always the first concept you always have to think about, is push away from support points. So what do we do with her? After we did the body work, and this is another piece about the movement thing. Please, if you've injured yourself, seek out, first, of course, get cleared so there's no broken bones or no, split and torn ligaments, right? But if you're clean there, and even if sometimes if you have some problems with your ligaments and bones, you can still get body work done from a qualified professional. That can reset your body and stop the damage that happens from 3 months of this, and now all her tissues are shortened, and now we have a lot of work to do to get her out of the gutter. Get body work quickly. Okay, so that's my first piece. What did we do with her? We taught her what? We taught her how to raise her arm again. We taught her how to stabilize her shoulder, but not until she learned how to stiffen her core and make her core and her breathing the center of her life, right? As soon as she has the strong center, now she can put her shoulder blade down into her back pockets, and now she can feel what it feels like to have a shoulder pattern that feels correct again. So that's the first thing, is we just had to, no, she didn't have that much movement because she's still kind of frozen underneath her shoulder. But at least what we're practicing is the first steps are activating that down and back response of the scapula or the shoulder blade, and the ability to let the arm literally be kind of flung up. Instead of lifting it like this, we want it to be thrown up. By the downward here causes a upward here. You see that? So that's what she's working on. And of course, we're trying to get her range of motion back. So last visit, this is another thing you can do if you're looking for good range of motion in your shoulder, is get on all fours and just practice literally rocking like so. Rocking like so. And you don't want to do that in this position, right? It's all about up and making sure your shoulder blades are down. You don't want to have your ears in your shoulders. Down. Rock back. Because what is that? That's this. Right? Except you're doing it from a nice neurological, neurodevelopmental position of crawling like a baby. And there's something about that position that resets the nervous system, so it's great to do things from that position. So we didn't automatically go to the classic, do 3 sets of repetitions with these bands, right? We went and did some other things. So that's the movement piece. Now, the nutrition piece. What's the other pillar? Nutrition. Gentleman comes in earlier this week, I think Monday. Trouble with weight loss, trouble with high blood pressure, trouble with insulin and sugar and all this kind of stuff. And he came in to me and he said, I found something that's really working for me, and I want to share it with you as well, because this is important, and it was important for me as well. And he said he started doing The Plan, the book The Plan. I can't remember the author, I should have that, but the idea of The Plan is talking about getting rid of reactive foods in your life. Because when your body is reacting to foods, because your body is either allergic to it, like it's reacting like you eat a strawberry and your lip blows up, right? That's one type, that's an allergy. But there's also sensitivities that you don't even notice until 4 days after you've eaten it. And what that does, if your body is reactive and has sensitivities to foods that you're eating every day, this is causing a chronic inflammation response in your body. When your body is under chronic inflammation, you gain weight, very simply, okay? Because in order for your insulin to do its job and to be sensitive to insulin, so insulin comes in and docks on the cell and gets the, tells the cell to take all the sugar and get it in and burn it for fuel and all this stuff. If those receptors on the cell aren't getting the message correctly, your body ends up putting out more and more insulin, and what it is this more and more insulin creates more and more fat storage. Okay, so when we have lots of inflammation on board, basically it messes up your receptors, so your hormones can't talk to each other effectively, and you become more insulin resistant. That's just one way that it causes weight gain, right? And besides that, it's stress to your body. What does stress do to your body? Causes you to burn sugar, or excuse me, to crave sugar and burn sugar and not burn fat. So take sugar, turn it into fat. Eat sugar, turn it into fat. Eat sugar, turn it into fat. That's the process of stress. That's what stress does. So bottom line here, guys, let's wrap this up, is that we do not want to consume reactive foods. So here's, you can get the plan and check it out. This is new. I have not read the book, but it just brought up something that I need to do more of in my practice, and I do it regularly, which is the first thing we're going to do is do this modified elimination diet. These are the first things we do. We get rid of all of these reactive foods, or potentially reactive foods. These are the most common ones. And I'm going to post that down below, the modified elimination diet, okay? It's basically going to get rid of wheat and dairy are the two biggies, and it's going to get rid of some other things as well and give you some options to choose from. So you're going to have that. And that's where you start, right? And you clean the house, right? Even if it's for 2 weeks, and you do nothing with that modified elimination diet for 2 weeks, and then one thing at a time, you add back in. Boom. It's the classic elimination provocation diet. That's what the plan is kind of all about. She's got some other twists on it, but that's basically what it is. Provocation elimination. It's been around for centuries, right? The rare foods diet was in the 30s or something. They called it the lamb and pear diet. Just eat things that you don't normally eat, like all day long, every day. So you got to have variety in your diet. So that's what this whole process is. So we need to get rid of those reactive foods. This modified elimination diet, a lot of times, that's all people need, right? Open up the floodgates so your inflammation is lowered, your machinery can do what it's supposed to do, you start burning more fat, craving less sugar, pounds start dropping off. It's a happy, happy, happy thing to have happen. Okay, so that's the mindset, movement, and nutrition. Again, mindset. Don't let anybody put conditions in your brain and put a label on your forehead. Look at processes, dysfunctions, and imbalances, not conditions. Number one. Number two, for movement, we want to, what was the movement? Oh, it was about protection posture. That anytime you have an injury or stress, you go into protection posture, and you have to get out of that protection posture, or else you're going to get frozen in that protection posture. You get what I'm saying? That's what Reverse CPS is all about. That's what the course is all about. That's what the Core Wellness Institute is all about. Reversing these cross-to-posture, stress-induced muscle imbalances. Lastly, the gut. Get rid of the reactive foods. Try the modified elimination diet for 2 weeks. That's all I'm asking. Just try it for 2 weeks. And then, well, it's better a month, okay? But 2 weeks, that's all I'm asking. Even just wheat and dairy for 2 weeks, for goodness sakes. And things could just explode for you. Fog could lift, pain could drop, and it does happen. It's amazing. Anyway, modified elimination diet for a couple of weeks, and then you add one thing back at a time, and you wait a few days and to see if you have any old symptoms recur. Guys, that's it for today. If you want any information about our new upcoming release of the Core Wellness Institute coaching course, you can put your name and address or just your email down below, and you'll be the first to know when we open that back up. That is going to open up really, really soon. Otherwise, have a great, great day, and thank you for listening. I appreciate you so much. Bye-bye.